external rotation. That's your pattern. Or you can call it D1 or D2, whatever you want to call it. So again, you're just, and it goes along with the scapular. So again, with this type of a thing, hand placement supposedly is key, and I'm not really good at this myself, but you can certainly work with the elbow flex and just concentrate on the shoulder unit, okay? Or you can work on the whole arm, and this is where you probably do want to look down at your hand. Okay, I want you to grab your grab your finger and rotate your thumb up, and then provide, go ahead, pull up, pull up, pull up. All right, open up your hand, push down, push, 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 push. Okay, close your hand up, pull up, pull up, pull up, pull up. Then you got to change your hand in order to get them to get that rotation. Okay, so that's like the hardest part if you're going to do a slow reversal. Okay, the D2 pattern, D1 pattern, you start in the extended position, adduction, internal rotation, extension, external rotation, adduction, and out. And again, this is where I think it does help if you tell your patient a little bit about it. Your thumb's going to come up, you're opening your hand up, and you're going to bring, and look up at your hand, so you follow your hand so you get the head involved. All right, go ahead, thumb's coming down, pull down, pull down, pull down. Or you can just concentrate on, go ahead, push up in my arm, open that hand up, push, push, push. All right, bring that thumb down, pull it across. You may just use your resistance in the shoulder unit and watch that hand, because that may be the weaker link, and that's where you get a little bit out of eradication down into the hand. Okay? I think the leg patterns are a lot harder to do, but certainly, okay, you have, I think I said the D1 pattern was adduction, right? External rotation and flexion. Internal rotation, abduction, extension, okay? Or flexion, abduction, internal. That's like the fire hydrant on the dog, right? And this is like your ballet pose, okay? Okay. So again, you can concentrate on just working the proximal units, or you could try to work on, and again, it's harder because the foot's supposed to come up. So you want to push that toe out, push into my hand, come on out, push out, push out, push out, push out, push out, because she's going up, okay? And then you're going to have her pull in. I'm not doing a real good with the rotation there.
I have crazy tight rotators, that's okay.
Okay, so let's see. Other techniques. You can also consider doing diagonal patterns in a closed chain fashion. So if I have her do, you're going to lift your leg up, push. What's she doing there? Just like roll. Okay, so she's pushing, so she's extending, hip extension, adduction. Is she internally rotating? Internal rotation? Okay, and come down. Okay. So as long as you're seeing this distal component or the proximal component going through rotation, she's also going through that pattern. So one of the things I think we had in as a technique was to do the, what is it called? Combination isotonic. So I don't really like the terms that they use, and this is coming right out of PNF Lab. But essentially, instead of doing a reversal, your hand placements are going to go through the concentric and then allow them to come back using eccentric loading. So if I was going to do that diagonal with her, with a bridging activity like this, I would say, go ahead and push into my hand, push up, push up, push up. And then I'm going to say, let it come down slowly. Let it come down slowly, but I'm going to keep the resistance, let it come down slowly, so that she's still maintaining some pressure against it. You don't have to do this as a PNF technique. You can do it as a diagonal. Some people do this with bridging, so I had push up into my hand, push up, push up, push up. Now come down slowly, come down slowly, come down slowly. Okay, or you can do it in a way where legs over your foot. Bend your knees. Sorry. Relax your legs for it. I'm going to place your feet on the deck. All right?
Okay.
Just over to the side. Just a little. Okay, what we're going to do is we're going to bring your hips up, and then we're going to move your hips over. So I can actually do a symmetrical pattern. She's going to lift up, and then lower your bottom slowly. So you're kind of resisting in this pattern, and then you're letting yourself come down. Remember that lady, that little home care lady, and the therapist had their hands on her? That's what she was doing. So, and I could say, come back up towards me, come back up. Okay, lower the opposite direction. Okay? So it's a harder thing to do, especially providing pressure and having her say, keep resisting into my hand and come down slowly. Is that your understanding of that one?
Yep. Yeah. And that it gets the concentric and the eccentric because you're working the same muscles in the same motion. It's just doing it in both directions because it's concentric and eccentric.
So the other techniques you guys already learned had to do with that contract, relax, and hold, relax. The difference in terminology between hold, relax, and contract, relax is whether you allow motion to occur. So if I was working her and she was limited in this range up here, right? So I was doing my pattern here and she's limited. I go to the close to the end range and I say, I'm hold, push down into my hand, push down, push down, push down, push down. Okay, relax, and then I'm going to passively stretch her into that motion. Okay, and I always forget, one of them is you allow a little motion to occur, so push down, allow a little motion, relax, and in that period where she relaxed, you're going to try to stretch that muscle. Or you take her right to end range and you say, hold it, hold it, hold it, push, 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 push. Okay, relax. Am I hurting your hip?
No.
Okay, sorry. But again, you're using a pattern, a diagonal pattern that you're doing now. And you're just focusing on it. And then the replication, that last one just means that now after you've done this and you gain more range, I'm going to say, go ahead, pull up in that, pull it up, come on down, pull it up. So you're going to have her work, pull up in that, pull up, relax, pull up and in, pull up and in. So I'm going to have her work in that range that I just gained so that she gains some ability to move within that range. You just free it up with your contract, relax method. So contract, relax, and hold, relax are both techniques to get movement into a range the patient's not working in. And I forget which one. I think it's the contract, relax, actually, where you allow a little movement, and the other one you just hold and you don't let them move. Okay? And both of them are kind of going on that post-excitatory inhibition, kind of letting the muscle contract, and during that relaxation phase, you can get a stretch on it. Okay? You might see that a lot in your patients that, you know, if you're working on a shoulder patient and you're working on gaining range up here, okay, and I'm doing a little contract, relax, so go ahead, pull up, pull down, pull down, pull down, pull down, relax. Okay, stretch, pull down, pull down, pull down, pull down, pull down, relax. Okay, and then I'm going to bring her up here and I say, now, go ahead, push back into my hand, in that range. So you'll use your push back, push back, push back. So you used her active movement into that range that you were just doing contract, relax. That's replication.